On this Tuesday night, exclusive new details about a Quebec seniors' home under criminal investigation. What documents obtained by Global News reveal as care homes across Canada are overwhelmed and many understaffed.
We tend to devalue the work of caring for people.
One premier's plea for more help. Alberta's success in fighting COVID-19, how its response compares to other provinces, and the Premier's plan to circumvent Health Canada. Is this China's Chernobyl moment? The experts, including a former Canadian Justice Minister, accusing Beijing of a coronavirus cover-up. And when home is not a safe place.
We're in a pressure cooker of stress.
The troubling rise in domestic abuse.
Global National with Donna Friesen.
Good evening and thanks for joining us. Across the country, this is a heart-wrenching time for families with loved ones in long-term care homes. Residents have been dying in their beds. Their family members are banned from visiting. In many homes, there are not enough staff to take care of everyone. And all loved ones can do is anxiously wait for word on where the next outbreak will be.
The sad truth is, our long-term care homes are quickly turning into the front line of the fight against this virus. And my top priority right now is getting the troops and the resources needed to this front.
About half the deaths from COVID-19 in Canada are in long-term care homes. The outbreaks are worst in Ontario and Quebec, where more than 400 facilities have detected the virus. These are just some of the homes. In each of them, at least 20 or more people have died of COVID-19. Ontario's Premier says the virus is tearing through care homes like a wildfire. He vows to do what it takes to save lives, including putting hospital teams into infected care homes and doing more screening and testing of staff. And he's following the lead of BC and Alberta, banning care home staff from working at more than one facility. We'll have more on the political response in just a moment, but first, Mike Armstrong on how the coronavirus is ravaging Canada's care homes, including one that's under criminal investigation.
With every day that passes, new nightmare stories trickle out of this seniors residence. One of the latest from March 29th. A doctor from the local health authority couldn't reach anyone on the phone, so she went in person. Dr. Nadine Larente says she found 130 residents being cared for by 2 orderlies and a single nurse. Desperate, the doctor called her 3 teenagers and her husband for help feeding the residents. Quebec's Premier Tuesday thanked Dr. Larente and her family for their humanity, he said, on behalf of the entire province. Now, according to documents obtained by Global News from the residence's owners, the facility had a sick nurse on duty showing symptoms in the days before people started dying. On the 29th, according to the documents, when the facility was placed under trusteeship by the local health authority, only 3 patients had died. In the 2 weeks since, even under trusteeship, they've lost 29 more. As recently as Monday night, new positive tests for COVID-19 were still coming back. Now, the facility has had issues in the past. A coroner's report into a resident's death last year questioned the training of the staff. The company that runs the facility says it provides adequate care as confirmed by the most recent March 2019 government inspection. The company says public health officials created a catastrophic situation when they took over, failing to isolate infected patients and failing to properly treat and medicate others. But what's becoming increasingly clear is that even in normal times, it is demanding and difficult work for employees at care homes to meet the needs of residents. The COVID-19 pandemic is a breaking point. Close to 300 facilities in Quebec are struggling with COVID cases. About 10 kilometers away, this residence has had 26 deaths. Just north of that, another institution has lost 33 residents. Among them, Solange Arsenault. She was 70 years old. Her wife, Anne Kettenbale, calls the situation in residences immoral.
This is not something that just happened by accident. They were never among the institutions that were going to get the resources.
Kettenbale says hospitals were prioritized at the outset of this crisis, and rightly so. But now governments have to pivot. Hospitals aren't as overwhelmed as predicted, while hundreds of seniors' residences across Canada are. They need help.
It has to happen yesterday. It has to happen now.
Whether they have cases or not, seniors' residences are locked tight. That doesn't only go for visitors, but at times information as well. This Toronto facility has had 25 residents die.
So I went for 3 weeks thinking my father was fine. He's not, he's dead.
The biggest challenge is staffing. Employees are staying away because they're sick or fear getting sick. Quebec is asking anyone with experience in healthcare to come forward, and it's talking to Ottawa about using soldiers in seniors' residences.
Yeah, we're asking them how many people with the expertise in health care can be sent to us.
What has become clear in this crisis is society's most vulnerable people were being housed in society's most vulnerable institutions. Mike Armstrong, Global News, Montreal.
As Mike said, working in a care home isn't easy. It involves deeply personal tasks like feeding, dressing, and personal hygiene for the residents. Those who do that work get low pay and often work part-time in several homes to make ends meet. Canada's health minister says it is obvious now that has to change.
We tend to devalue the work of caring for people. And I think this is an opportunity for Canada to actually think a little bit more about how we will move forward with a stronger system of care for people who are aging. Because in fact, all of us in this room are going to end up there. And these are our mothers and our fathers and our grandparents and our aunts and uncles.
In the short term, though, lives need to be saved right now. David Akin is looking at what measures are being looked at and which provinces are getting it right. David?
Well, Donna, for most of this crisis, the fear was that hospitals would be overwhelmed. And in fact, it is long-term care facilities across the country that are facing the most stress.
Despite our best efforts, we're dealing with a wildfire at our long-term care homes right now.
And just as in Quebec, Ontario is desperate to find more firefighters, the nurses and personal support workers who can help take care of seniors. To that end, the Ontario Premier vowed to redeploy teams of hospital workers to long-term care facilities.
We'll spare no expense to protect our most vulnerable. We must redeploy every available resources to our long-term care homes right now.
Ontario, like Quebec, is also looking to boost the pay for part-time workers looking after seniors. And then there's the rules, the protocols that operators of long-term care facilities must abide by. Those rules are set by the provinces.
I would say that every province and territory really sees with, doing best practices.
So far, at least, the federal role has been one of coordination and information sharing.
Seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Those just updated guidelines incorporate current practice in some provinces. British Columbia's decision last month, for example, prohibiting caregivers from working in more than one long-term care facility. Ontario's premier said a similar rule would go into effect in that province overnight.
I will say that there are some people getting it right, and it's slow, but it's coming.
And those improvements cannot come soon enough for Quebec and Ontario. The premiers of both those provinces today saying that the health and protection of seniors in long-term care facilities is now their top public health priority, and it's a concern right across the country, Donna.
It sure is. And David, I want to ask you about something else. An open letter is circulating, signed by politicians and academics from around the world, including a former Canadian Justice Minister, Irwin Cotler. It says the pandemic has been caused by China, and it calls it that country's Chernobyl moment. The letter says we should never forget that China's Chernobyl moment was a self-inflicted wound. The CCP silenced Chinese doctors who wanted to warn other health professionals during the early stage of the outbreak. David, it also criticizes the World Health Organization, claiming that it bowed to Chinese pressure to downplay the severity of the situation. Have any Canadians besides Irwin Cotler signed it?
Well, Irwin Cotler was certainly the most prominent name on that list, the former federal justice minister, longtime human rights activist. But there were some other Canadians there as well, authors, commentators, academics. And this group has really been trying to sound the alarm about China for some time. But the Canadian government not ready to join in on that criticism. Deputy Prime Minister Chrystia Freeland noting that the World Health Organization gets its information from a variety of sources. She also had some classified intelligence that she couldn't talk to us about. But there might be one more reason here, and that's this. China right now is a vital source of the ventilators and masks that Canada urgently needs. Donna?
All right. David Akin in Ottawa, thanks. Alberta's Premier Jason Kenney is criticizing the response of Canada's Chief Public Health Officer to the pandemic. Kenney says Dr. Theresa Tam listened to talking points, as he calls them, from China and suggests she put too much faith in the World Health Organization. Kenney also says he intends to circumvent Health Canada and will not wait for it to approve new medications, tests, or vaccines for COVID-19. He says he intends to bring those things into Alberta as soon as they're approved by European or American health regulators. This is how Canada's Deputy Prime Minister responded.
We have shown that we are a country that does believe in the value of expertise and in the value of science at the federal level. I have observed as a former journalist that chief public health officers across the whole country have become this generation's rock stars, and that is entirely appropriate.
Alberta has expanded who can be tested for COVID-19. The province believes it now has capacity to test anyone with a cough or a runny nose. No other province is at the point of testing that extensively. Tonight, Heather Yourex-West examines why Alberta now appears to be ahead of the curve in its response to COVID-19.
As hospitals around the world scramble to obtain desperately needed medical supplies, Alberta has been flying in massive shipments. This cargo plane from China brought more than 36,000 kilograms of masks, gowns, and face shields.
There's a high level of confidence in the suppliers that we are working with, as well as in the transportation networks that we have established with some of the airlines in order to try and bring those things up.
Over the weekend, Alberta's Premier announced surplus medical supplies will be sent to other provinces in need. In the face of this global pandemic, Alberta appears to be in a rare position, well prepared for what's to come.
Some people, they'll put in, some resources. Others will say, no, we're all in. And I think Alberta, we saw early on, 2009, 2010 and on, that they took approach of all in.
Pandemic planning experts say Alberta's position is the result of more than a decade of behind-the-scenes work. Nearly every hospital falls under a single provincial superboard, and all supplies are tracked centrally in real time.
When news broke in China in December that this mysterious viral infection was spreading, Alberta knew exactly what it needed, where it was going to need it.
That level of organization may also be why the province has been able to test more people per capita than any other jurisdiction across the country.
You have previously heard me say that we were not able to test every Albertan with a cough or runny nose, but we believe that we may now be at the point where we can do so.
Alberta's response has not been perfect. Some frontline doctors who practice privately have had problems accessing personal protective equipment, despite the province's excess supply.
There are a lot of physicians out in the community like me who are not part of VHS, so we don't get access to the resources that VHS has.
Still, compared to many other places, Alberta is in an enviable place, well prepared in the face of a global pandemic that has caught too many off guard. Heather Yourex-West, Global News, Calgary.
Vulnerable communities in Canada's north are getting some financial help from the federal government. It will provide $130 million to help territorial governments maintain supplies of food, medicine, and other essential goods and shore up health and social services. And mandatory requirements are coming into force tonight for all travelers entering Canada by land, air, or sea. They will have to have a credible self-isolation plan. Those who don't will be sent into quarantine for 14 days at a set location, such as a hotel.
For example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination, if they've been outside of the country for many years, we now have the authority to require them to self-isolate for 2 weeks.
In the United States, President Donald Trump has announced he is halting funding to the World Health Organization while a review is conducted. Trump says the review will assess what he calls the WHO's role in mismanaging and covering up the spread of coronavirus. Under his watch, though, cases of COVID-19 in the U.S. keep rising. More than 600,000 people in the U.S. are now known to have COVID-19. That's an increase of 100,000 in 4 days. That's only the people who have been tested. More than 25,000 people in the U.S. have now died from the illness. As Jackson Prosco reports, President Trump says the decision on when to begin lifting restrictions and restarting the economy is his alone.
Do you feel you're as good as you were before this happened?
With his country gripped by the virus, U.S. President Donald Trump met COVID-19 patients who'd successfully recovered.
I honestly felt I was going to die.
Their hopeful stories were quickly overshadowed by more dark news.
Everyone is COVID positive in these hallways.
New York reached a grim plateau, 778 dead in 24 hours. The fatality rate remains stubbornly high. And now the response to the crisis threatens to be derailed by a political fight. The president wants to force states to end social distancing measures sooner than later, as he pushes to restart the economy.
The authority of the President of the United States having to do with the subject we're talking about is total.
On Monday, Trump falsely claimed to have absolute power to end local stay-at-home orders. He has refused to issue a national stay-at-home directive of his own.
The president's position is just absurd. It's not the law. It's not the Constitution. We don't have a king. We have a president.
Health experts have pushed back, warning that now is not the time to ease up.
This is not the debate that we ought to be having. This is a public health crisis. We're at the mitigation phase. We're trying to reduce debts in this country.
But Trump seems desperate to move away from talk of the response, eyeing a recovery before November's election, as questions grow about his handling of the outbreak and why there wasn't more done to prepare before the virus grabbed a foothold in the U.S.
What did your administration do in February with the time that your travel ban got you?
A lot. And in fact, we'll give you a list. What we did, in fact, part of it was up there. We did a lot. Look. You know you're a fake.
While all that was going on, California's governor was laying out what a reopening could look like. It won't be happening anytime soon and will be phased. One example he provided was restaurants, which could see the number of tables and chairs cut in half, servers in masks and gloves, and disposable menus for the customers. Donna.
All right, Jackson Prosco in Washington, thanks. Coming up, strutting her stuff, the Canadian woman bringing smiles to her street. Russia's president now admits the coronavirus is going to hit his country hard. There was talk Vladimir Putin's early move to shut down most travel from China, plus extensive testing and contact tracing, was succeeding, but Putin has told advisors Russia doesn't have much to brag about now. Russia has hit a new high of 2,700 confirmed new cases today. More than 21,000 people have now tested positive, and at least 170 Russians have died. Moscow is hardest hit. New hospitals are being built and lockdown measures are in place, but Russians are being warned to brace for the worst. Some lockdown restrictions are easing in parts of Italy. Dozens of small shops in Sicily and Venice are open, but with strict rules on customer numbers and hygiene. Italy recently recorded its lowest increase in daily deaths since March. Strict physical distancing measures and lockdown measures, too, are in place in Italy's worst-hit regions, though. In Austria, a lot of shops have reopened, too. The country hopes to reopen restaurants and hotels in mid-May if the number of new infections there remains low. Ahead, abuse during this pandemic, why staying home is anything but safe for some people. Being told to stay home can be like a death sentence for those whose home is not a safe place. Crisis lines across Canada are getting a surge in calls right now from people who need help. As Robin Gill explains, the public health measures meant to protect lives are putting some people at even greater risk.
In early April, Tracy McKenzie's body was found in her Nova Scotia home. Immediately, prosecutors called it a case of domestic homicide and charged her partner.
Every 5 days, a woman in Canada is killed by her abusive partner. We don't know what that's going to mean under COVID-19.
The stay-at-home pandemic measures are forcing Canadians to spend every hour confined in their homes. For people in abusive relationships, it only further isolates them.
We're in a pressure cooker of stress right now, that everything that contributes to rates of domestic violence increasing, from economic downturns to natural disasters, it's all happening.
Calls to crisis lines are up from victims, their children, even the perpetrators asking for help. Not everyone will turn to a shelter. There's the dilemma of living in a communal space with the threat of COVID-19. Plus, physical distancing measures issued by public health agencies are limiting space in these safe havens.
Violence against women, children, and youth is already a significant public health safety emergency in Canada, in North America, and across the world. So the pandemic is just exacerbating an existing public health and safety emergency.
The United Nations is sounding the alarm on this collateral crisis.
For many women and girls, the threat looms largest where they should be safest, in their own homes.
Already, there are signs of a surge in domestic violence in places where COVID-19 has a grip.
The initial reports coming out of China is that domestic violence has gone up threefold. There was a report yesterday that came out of France saying that their rates of domestic violence have already gone up by 30%.
Support groups are asking neighbors and family members to check in as much as they can, to set up secret signs to let them know they're okay.
We do know that increased isolation, it just compounds things extraordinarily.
Tracy Mackenzie's friends and family only wished she'd reached out before it was too late. Robin Gill, Global News, Vancouver.
Mrs. Dress Up. Next, one woman using her tickle trunk to keep spirits up.
Hey, Mr. Potato Head!
We're all doing what we can, right? This New Brunswick woman is trying to make kids in her neighborhood smile with some costume changes. Debbie Tingley, like everyone else, is staying physically distant from the ones she loves, so she took her tickle trunk to bring some joy and some laughs to her community. Some costumes were a little more difficult to get into than others. Even the Easter Bunny eventually made a special appearance. Always good to make someone else smile, especially these days. And that is Global National for this Tuesday. I'm Donna Friesen. Thanks for watching, and take care of yourselves. Bye-bye.